You need to fire at this?
I don't think so.
Oh. Not going?
Not going. There we go. I might just have you do it manually. I think it might be out of battery. I'm not sure.
We have an echo.
All right. We good?
We still have an echo. And I just echoed Erica too, when she said I have an echo.
How about now?
Yeah.
Good.
Oh,
No.
Don't say anything.
I thought it was just me for a minute. And then, of course, we joined in 2024. So it's kind of some of the efforts and a lot of the tools are through AARP here, as well as through our state partners. So it's been it's really been a fun movement. But the movement broadly aims to improve these 8 domain areas, and it really is just that we're intentional at looking at these. And so the built environment, and that one's not actually flipped. So it does provide structure in the 8 domains of livability. And the top portion is the built environment, and that focuses on housing, outdoor spaces and buildings, and transportation. And then, excuse me, the social environment, which focuses on health services, community supports, like many of our partners on the Aging Coalition, social participation, respect and social inclusion, communication and information, and then civic participation and employment. So those are kind of the 8 areas of domain. One was added on during COVID, that's emergency preparedness, and that's one that Andrea has done a lot of focus on as well. But this is sort of the general overview of the model, is to put this framework into all of the work we do across, certainly across Cook County as different departments, but as agencies and businesses do the work, is really where do we, where every area of our community has the opportunity to, whether it's to improve communication or to look at respect and inclusion, to look at how we enter into offices or spaces or businesses. Are there steps? What kind of barriers are there? So it's kind of all of this lens of looking at every aspect of our community through this lens. So that's just broadly, again, that age-friendly lens.
No? Good morning. So I'm going to describe about our county demographics. Start by saying that Cook County spans more than 1,450 square miles, making it one of the largest counties in Minnesota by land area, yet with a population of just 5,800 residents about. The communities that are in the county are represented by Grand Marais, Grand Portage, Lutsen, Tofty, Schroeder, Hovland, the Gunflint Trail, Mid Trail, and Up Trail, and in the greater Cook County. Each one of those locations carries their own character, history, and cultural strength. And on the graphic right there, we want to highlight how the older adults now make about 1/3 of the population. And this portion is growing as residents age in place and retirees move here. This trend will influence our services, our workforce, and our long-term planning for many years ahead. I would like to say that extreme seasonal weather, long distances between communities, and very limited public transportation add to the challenges of rural living. For residents without a personal vehicle, simply reaching healthcare, groceries, or social activities can be difficult. Housing options are limited, especially one-level or accessible homes, and the middle housing is nearly non-existent. In the next slide, we can see the projection for the next till 2050 of what will be the demographic distribution based on age. And then we can see on the slide that in the year we have to focus on the green bar. That would be representing our older adult population. On 2024, we were at 30% by census data, but the projection that was by now 2025, we're at 33%, and is likely to increase all the way to 2035, that we will reach our peak of older adult population. And then it's like slightly going, the curve is going down. Oh, and then highlight that the school-age kids compared to older adults is significantly, is less than half. So we can see there are age distribution and how important it is to address our older adult population. Now I would like to talk to you about the community engagement process. So this project, as its named, was carried out by Cook County Public Health in conjunction with Cook County Care Partners. So Julie Wilson and I went along went around the county in about 11 listening sessions in which we engaged with the community members in all those different locations that are across the county. And as well, we did launch a survey based on 86 questions that touched in the 8 domains of livability that were mentioned earlier in the slide, but adding a 9th domain that was added after the pandemic, which is called disaster preparedness. So out of the listening sessions and the survey results, we came up with key findings. And for those, the top 5 priorities of area, domains of livability, would be health services and community support. And that includes access to in-home care, caregiving support, and specialized services. Housing, especially about affordable housing, safe and age-friendly homes. Transportation, this is highlighting the many residents unable to access essential services without personal vehicle. Disaster preparedness, that highlights the importance of ensuring that older adults are included in planning and communications for severe weather and emergencies. And community and communication and information, with a particularly need for clear, reliable awareness of available programs and support.
Okay, so to just kind of touch on this, because I don't think we need to spend too much time, but just kind of a visual for you all again of where we have been. We did the initial enrollment, and we applied for the grant to do this kind of assessment process. And we kind of went through that process. In the first year, we did a lot of that work. And then this last year, we've been working on the action plan. The next couple years, then we intend to implement the action plan and track our progress. And this is through 2029, I believe. The grant itself is through the end of this first quarter in 2026. But then to evaluate the impact. So that's just broadly our timeline for this particular season of this project.
So this slide just reiterates what those top priority areas in the domains of livability are. And I'll add that when we did this project, we were very intentional to align it with our community health assessment, because that's an assessment we already are required by state statute to be completing and working towards in the form of our community health improvement plan. And it happened that we didn't make this happen. It happened organically that there was alignment between the priority areas we found in our age-friendly work and in our community health assessment. So going forward, regardless of what happens with grant funding, we intend to use this age-friendly lens when we're doing community health assessment and community health improvement plan, because it makes sense given the changing demographics of our community and just respect for that full lifespan of residents from, very, very young to elders in the community, to include this principle of what does it mean to look at our community through an age-friendly lens. So you'll see quite a bit of alignment, and that was both, it makes sense. It's sort of affirming of that the priorities for our older adult population very much align with the priorities for our community overall. But using that lens is what makes this project unique and different and gives us a tool that we can carry forward. So the remainder of the presentation is actually going through section by section of the plan, these different priority areas, and talking through what our goals and strategies will be.
As I mentioned earlier, housing has emerged as one of the most urgent concerns during our community forums and survey. Residents describe the gap between existing housing stock and what older adults need to safely age in place. For example, one-level living, accessible design, affordable options, and modest modifications like grab bars, weatherization, and improved insulation. So these challenges are intensified by Cook County's climate, the age of the existing homes, and the limited local contractor pool. So together, these factors make aging in place more difficult and place older adults at higher risk for unsafe living conditions. So this plan focuses on strengthening the practical support, education, cross-agency coordination, and direct housing assessments to help residents remain safely housed in their community. As you can see, the table, and maybe you could see it better in the plan that you have printed with you, that the main goal is to support access to safe, stable, and age-friendly housing. And then for that, we have 4 strategies. One is to advocate for accessible, creative housing options for older adults to age in place. And for that one, is coordinating these goals with the HRA, county zoning, the healthy home programs to prioritize aging in place designs and modifications. So the second strategy is to convene healthy housing network, continue convening. I just want to explain a little bit the healthy housing network that has come up with the healthy housing program, and one of the main goals of that program is to have recipients of that. This year, we are in a 3-year cycle of a grant received by MDH, and one of the goals is that out of the 39 healthy home projects we were going to do, 10 would have to be older adults. However, at least half of those recipients have been older adults. So I think aligning those goals with the housing plan is one of our priorities. The next is continue to offer healthy home assessment for older adults, again, to create those modifications that are needed for them to age in place, and to educate them about what needs to be, educate them about what does it take for them to age, have healthy aging at home, and by going through the checklist on the visits that we do. And then continue to provide education on housing and advocate for the needs of older adults.
So the second area that our community informed us was a priority was transportation. I'm sure no surprise there. That's another key one. The goal is to improve then access to reliable, accessible transportation for older adults, and the strategies are to provide options for non-emergency medical support, so like we do at Care Partners and through in-home support here at the county. And then the implementation is to continue to recruit volunteer drivers as we continue to see that need increase, and then really kind of hoping to assess the Boreal Transit project that had also had a grant a couple years ago, and is kind of in the process of assessing the future of that project through the county here. Metrics are annual recap of volunteer driver capacity and the needs for both Care Partners and Cook County Human Services, and we will utilize the aging coalition that exists, the Cook County Aging Coalition, as a place to I suppose, a little bit of accountability and building collaborations around that. And then outcomes is a stable range of non-emergency medical transportation resources that be available to older adults in Cook County. And then further down, if you look at the strategies, is also to continue to partner with regional transit efforts through AEOA and really being involved with and participating in their advisory council meetings. And then a quarterly report on any AEOA updates also to the Aging Coalition. And I also think the PHHS Advisory Board is another place we didn't write here. Greater awareness. Outcome would be to just have greater awareness of regional transportation resources, challenges and opportunities to develop further commitments there.
All right. The next domain is information and communications. And our goal is that older adults receive timely and accessible information on resources. And our two main strategies, one is to use local resource directories. So Care Partners, through the Aging Coalition, has developed a resource called the Aging Well Resources. It's an online guide. There's also a Care Partners staff that can answer the phone if somebody calls Aging Well Resources to help people navigate to what's available. And so part of that strategy is just really amplifying that resource and making sure that staff and community members know that it's available to them. There's also a project in the works that I believe this board is well aware of to create a more general resource directory website for the county. And so that will be another resource we can use to make sure that our community members know what's available to them. And then the second strategy is around emergency communications. There's some overlap here with the disaster preparedness domain. But when we think about how to communicate in an emergency, we don't want to assume that everybody is receiving information in the same way. So we want to make sure that we're going beyond communicating via social media and using print resources, other online resources, radio, as well as Andrea's done a great job at developing anticipatory guidance through things like the Winter Preparedness Campaign, the Magnet Project on what to do to prepare for a power outage. We want to make sure people get some of that information before there is an emergency situation, and that they're also guided to different avenues to receive information in the moment.
The third one, of course, is health services and community supports. That was something very loudly expressed concerns and needs. And of course, we all know the need to get to specialty medical appointments. And these are all so intertwined with one another, aren't they? As we know, transportation impacts, communication impacts, health and community supports, impacted by housing, and it's all a web together. But the goal under the health services and community supports is to identify and support community-based services that make aging in place feasible. Our strategies are to promote existing resources, such as the hubs, elder outreach programs, Care Partners, respite, care coordination services, Grand Portage elder wellness services. Just kind of really, again, that Aging Well Resources is a great place to make people aware. But again, it is a web-based thing, so we really just continued to hope that is utilized a lot by certainly professionals that are working with folks to help them become aware of what's available. Support, again, back to health services and community supports. I'm going to go across. Our implementation actions is to cross-promote programs across agencies serving older adults, and continue to refer clients to available services and agencies. Metrics, again, we continue to hope to work with the Aging Coalition, where there's already a natural coalition of people working together that have concerns around aging. And so sharing that updates with not only our own work, but what work is being done with by other agencies. And then outcome, older adults are well connected to be available community resources. And then also a strategy is to support caregivers and of older adults. And again, continue to support the existing support groups and promote peer-led programs. Metrics is the number of events and opportunities that are available for our caregivers to support them. And then outcome is that caregivers feel supported and connected within Cook County. And then also the strategy to address social isolation and ageism through community programming, and really amplifying, the Aging Well resources and the community event calendar that's there for older adults. Again, we can track metrics through Aging Well website on the use of that, and then older adults have opportunities to connect with community events and resources is the goal, that those opportunities are there. And then lastly, the strategy to continue to assess, and this is sort of an ongoing thing as a community we have, is to continue to assess and document unmet particular services. So this can go as deep and as wide as we're able to do in the future here, but things that, of course, such as assisted living, hospice, PCAs, respite, all of those needs of services in their homes that we know exist, to continue to assess that and document. So really gather information from potential service recipients as well as professional agencies on specific needs that are identified by specific individuals. We're going to create a data gathering mechanism and a timeline format for reporting back to the Aging Coalition on this as well. And then aging service providers are better able to describe unmet needs. So that's really the outcome, is that we're better able to describe what are the needs, specific needs, not so much broadly, but really specific needs of the older adults that wish to continue to live in Cook County and age here.
And lastly, I'll just touch on the disaster preparedness plan. And then the overarching goal is to prepare older adults for emergencies in ways that are practical, community-based, and integrated into the systems we already have. So I'm kind of like going to just give you a summary, not like detail by detail there. The main idea is that older adults can access preparedness guidance at the trusted places they already go, so reducing the barriers and strengthening their services. Also, neighbors checking on one another during emergencies is our main goal, to support the nature of our geographic area and how we are distributed here. So a buddy system is something we highly encourage. And also is to integrate an age-friendly lens into all public health emergency planning. This means intentionally centering the needs of older adults in our emergency plans, so specific sections to access to functional needs, with clear considerations for older adults across all hazards, and ensure that during emergency responses or under an emergency response, systems are more responsive to the realities and experiences of older adults in Cook County. So overall, we want our older adults to be better supported before, during, and after an emergency, and where preparedness is woven into everyday interactions, neighbor relationships, and county planning.
Oh, and here we are. What's next? So, really, our next initial step is to really to launch some follow-up. So, reporting back to the community on again, just a refresher on what the findings were, and then how we hope to continue these conversations. And present this work. So Care Partners does monthly lunch and learns, and we will do kind of an update and perhaps a charge for some idea opportunities at our lunch and learn in February. And then, yeah, just reconnecting with the community on some of these findings at various listening sessions again. And then really just, the focus will be really spreading awareness on the age-friendly lens and the tools so that we just continue to have that in the forefront of mind. I think especially in county planning at all levels is really, really important. And then from Care Partners' perspective, it's really continuing to engage the individuals, the older adults in the community, as well as other organizations and agencies and hopefully business as well, and really come up with some tangible ways to see this visually in our community really showing up, and we're hoping to make an impact. But our next steps are really getting this information out to our communities and helping them see themselves in this work.
And that's it for our presentation, but we're happy to take questions from members of the board. Commissioner Sullivan, I see your hand up.
Thank you so much. A question I have is, we have two organizations that are meeting tomorrow that would really benefit from getting a copy of your report. The HRA is meeting tomorrow, and we'll be talking specifically about senior housing. And also, the Cook County Local Energy Project is meeting tomorrow. HRA at 3, CCLEP at 5. And CCLEP has in the past contributed funding towards healthy housing. So I would strongly suggest that if you can get electronically this information to these two organizations, it would be something that would be very, very timely for them to take a look at.
Happy to do that.
Thank you.
Thank you.
Mr. Campbell?
Yeah, thank you, Madam, or Sir, yes.
I go by all names.
Thank you for the presentation. A lot of good information. I think as I hear the presentation, that the thing that impresses me is connecting resources on a local level, so we understand our community and connect them to the resources that are available. So if I look at all your different, points here, develop materials and communication strategies that consider how older adults receive information. That's an important one. I know in managing senior housing, the number of individuals that I have that have access to materials through the internet, and those that don't. It's a foreign world to them. And so I think that's a very important thing to understand how we do that. Sometimes we think technology is a resource and we make assumptions that everybody uses the resource, and they don't. So when we look at this demographic, I think that's an important point under your communication and information. The other thing is under health services and community supports, cross-promote programming across agencies serving older adults, and the association with ARP. There are many associations, and I just searched when you were presenting here, Minnesota Resources for Older Adults, and there are a number of these resources. So I think part of the analysis is looking at these resources, finding out where they provide information that we might not have, or making us aware of things that we might be missing. The Minnesota State Portal, Resources for Older Adults, there's just a number of things. So part of that speaks to the issue of not reinventing the wheel, but it goes back to my earlier comment about making these resources available locally and understanding our local demographic. And I think that that's certainly something that would be important. The other thing is that the Lunch and Learn, which is held at Higher Education, February 25th, it might be recommended, if you look at where you find seniors, where our population goes and is comfortable, to meet them in that setting. It might be good to look at having this option elsewhere in the community other than just at community higher education. The hub would be a suggestion, and then the east and west end, looking at how do we make it convenient for people to be involved in this process of informing us and us informing them. So those are just some thoughts I have. I appreciate the presentation.
Thank you, Commissioner Gamble.
Any other, Frank?
Thank you. Thank you for the presentation and that information. And I'd like to reinforce Commissioner Gamble's idea about understanding the local demographic. Okay? One little point, 20% of people 65 and older in Cook County live alone. Nationally, that number is more like 30%. So we have fewer people of that age group living alone. And there's some good reasons for that. Maybe it's just tougher up here to live alone than it is if you're in a city or something. And then therefore, people leave. But that's just one example of understanding how our local demographics are very important in addressing the local problems with our local resources. The other thing is, it's very easy to talk about the 65-plus demographic. There is no 65-plus demographic that has similar characteristics, okay? One way of getting around this, people talk about the young old, 65 to whatever. The literature is all over the place. They go 65 to 85, 65 to 75, whatever. But point being that there's a huge difference in the abilities, resources, activities of people the way I was 10 years ago, and my mother, who I'm going down to visit, who's 98. Okay, huge difference. So when you're planning your resources, when you're analyzing your data, I think you need to be a little finer in your parsing of the needs of the 65 and up. Huge difference. So just to bring that as an awareness, not only an age-friendly awareness, but understanding the difference in abilities and needs within that 65-plus community. It's huge. Okay. Otherwise, great work.
Thank you for bringing that up, Commissioner Sealby. I think I've heard that said that it's like comparing any other 40 degrees, 40 spectrum of 40 years in our life, the vast difference of that. And yeah, it's a really important thing to point out. Thank you.
Any other questions or comments?
Commissioner Mills?
Mr. Trump?
Thank you, and thank you so much for presenting today. I just have a question about the grant. You mentioned that actually, can you fill us in on the time period for the grant and then the possibility to apply for another grant?
Sure. So the time frame for the grant, we've received 2 awards, and that started in 2023, and it ends in 2026. So it goes through June, I believe it's June 30th of 2026 is the end of this grant cycle. These are grants that the state made available to local communities after the state decided to pursue age-friendly certification, with the understanding that this type of change happens in local communities. It doesn't just happen at the state level. I am uncertain how likely it is that these grants will be available for an additional cycle. I know that AARP has an alternate funding source for communities that have joined the age-friendly network. And regardless, being in that network does give us access to technical assistance resources that is valuable. So we're able to learn from other communities that are in the age-friendly network. But it was very intentional to layer this into our assessment and planning process for public health, so that regardless of grant funding, we are able to continue to use the lens and do the work at some level, although maybe not at the level we have been doing it with grant funding, but that it won't be something that we just have to set down completely if we are not able to secure additional funds.
Thank you.
And I can also address that, aging funding comes into our community through other organizations, outside of the county work, where we can also continue to utilize that lens, our care partners and the hub, and through the clinic and the hospital and different areas, where our hope is that this just really, that we as representatives, certainly, and all of you on the different committees and things, that we're bringing this thought and this lens into the work we do, no matter what it is. And so, but as far as funding goes, for some really tangible, specific things, my thought is that likely will come through individual agencies and collaborations, and maybe a little bit through the Aging Coalition as well, is what we will have to do if there isn't kind of that ongoing funding from at the state level, which is seeming not likely at this juncture, unfortunately. But
Mr. Gamble?
Yeah. The funding, 2023 through 2026, that's a 4-year grant?
So it's a little bit confusing. It was one grant with the opportunity to apply for some additional fundings and an extension. So it is technically one contract with DHS. We just received more than we initially received because we did successfully apply for that extension through 2026.
Okay. So, just wanting to understand it, if it's a single grant that the funds are distributed and you have 4 years to spend it, or if it's an allocation that comes annually in that regard, that's what I was
It's
wanting.
one award, and then we invoice DHS for funding to reflect the time that we've spent and the work that we've done on the project.
Okay, thank you.
Right. Thank you very much. Happy to see the action plan, and like you said, even without further grant funding, I think we have a structure and identified goals in place that we can work towards and use that lens in all of our decision making.
I would just, excuse me, I would just like to comment on these colleagues of mine at the county, and the really intentional way, because of this potential of not having ongoing funding, that they have really worked hard to build it into. Andrea's been really creative on bringing it into all the work she does, and Grace, of course, I think putting it into the CHIP, it has been a really valuable thing for our community, that it's sort of embedded in there, as she said. I think just kudos to my colleagues here at the county. So.
Here. I do recall when we first were talking about this too, the significance of the AARP funding and joining this and just having that additional potential resource too. So clearly all is not lost, and we've got a good product here already. So. Mr. Gamble.
Question about the funding. Is there a requirement with the grant that ARP has presented to report back as the results of what was accomplished using those monies?
So we do report quarterly to DHS. So each quarter we have a progress report that we submit to DHS, letting them know what it is that we did with the funding that they provided. And that'll continue through the end of the grant period at the end of June 2026. With the AARP, joining that network is it's what we applied to do with the grant funds, but it's somewhat separate. So if we want to remain active in the AARP Age-Friendly Communities Network, we do upload our action plan and our initial findings. So everything, there is like a repository for all of the age-friendly communities of what they're doing, which was actually really helpful to us when we were writing our action plan, because we could look at other action plans and say, okay, this is what an action plan might look like, and this is what we want ours to look like. So to remain active in that network, we do have to, within this 5-year period, upload our action plan and our, commitment from the board to join the AARP Age-Friendly Communities Network, and then report back. Otherwise, we would just become inactive in the Age-Friendly Network. So,
Okay, thank you.
And I would just add, from a funding perspective, the other value of being an age-friendly community is it does state that all of you and our community is very supportive of being an age-friendly community. And I think that statement, from my perspective as an agency, is very valuable in in other funding requests, right? To be able to state, we have a community that is very supportive of age-friendly initiatives, and we are part of the age-friendly network. And I think that, from my perspective as a director of an agency, that's really valuable as well. So, thank you.
All right. That's all then. Our next item is the director's report, and we will be ending at 9:30. So there's a couple items for board action too, but first I'll hand it over to Paul. if I may.
Thank you, Chair. I want to take a minute first to thank Andrea, Julie, and Grace for their work on this and the presentation for this very important and relevant topic for our community, and for their work to promote Cook County as age-friendly community, and for their collaboration and productive work between the two agencies. So thank you for all the work you've done and for this presentation. I'm gonna go quick here, be mindful of time. I'm gonna start with staff updates. We have an offer accepted for both Children, Family and Services case managers. One was projected to start on December 1st. We are working with, we're trying to assist with finding housing. I think last time I checked, housing was available, so I just left it between the two parties to negotiate and to figure out all the details. The other worker has accepted the offer, and with the projected start date of likely now as a January 1st. Of course, that's a holiday, so it will be adjusted accordingly. Second interview has been scheduled with the behavioral health supervisor candidate for this week on Thursday, where a large group of, well, I wouldn't call it large, but I'd call it multi, kind of, that engages different areas of our department and community, including Grand Portage Human Services, some consultants, Administrator Kristen, and some staff members. So we're looking forward to that. And of course, the Public Health and Human Services Director interviews are scheduled to begin first round next week. If and when we fill those positions, we'll be fully staffed for now until the recommendations come out from the consultants we're working on with, based on their work with our department in the next few weeks. And I do have a pretty good list of updates that I was provided by Grace, but I think I'm going to include that into the minutes rather than reading through now, to allow some time for the other board action items to be reviewed.
Okay, yeah,
Can I
Mr. Trumbull.
clarify one piece, which is that the director interviews, we will be reviewing applicants today and tomorrow and scheduling them on the 24th. We have a hold in place for that day, but they have not been formally scheduled yet.
Thank you. Okay, thank you very much. We'll move on down to the items for board action then. The first one is the mutual aid agreement. You want to go over that, Plumman?
Yeah, this agreement was first presented to me in the first couple of weeks when I started as an interim director, and my understanding, and then it has been reviewed by the county attorney with recommendation to be approved. What I learned since is that the counties in the region here, including tribal communities, have come together to sign this agreement to offer help to each other in case of an emergency. And it's basically providing staff support for each other and resources in various different emergencies that may come up. It has been reviewed by our emergency management director, again with the recommendation to accept it. Most counties have already signed an agreement, with just a few left, including Cook County. Therefore, I'm asking the board to take action today and approve this agreement, so we enter with the rest of the counties and tribal lands into this agreement.
Thank you. Commissioner Campbell.
Thank you, Mr. Chair. I'd make a motion to approve the mutual aid agreement 2025 through 2027, number 9509.
Thank you, Commissioner Gamble. We have a motion. Is there support?
I'll support.
Thank you, Commissioner White. Motion and support. Any further discussion? All those in favor?
Aye.
Those opposed? Motion passes unanimously. Thank you. On to item 5B is 2026 MFIP service agreement. Anything you'd like to touch on there, Plummer?
This is a standard biannual agreement we have with the Department of Human Services to provide services in our community. We do have a separate agreement with the AEOA to provide MFIP and DWP. MFIP is the Minnesota Family Investment Plan services. Again, I have reviewed that with our economic assistance supervisor, and I'm asking the board to take action and approve the agreement.
Any questions for Plummer? Commissioner Sullivan?
Mr. Chair, I'd like to make a motion to request the approval of the 2026-2027 Minnesota Family Investment Program Biennial Service Agreement.
Support.
Thank you. We have a motion and support. Any further discussion here? Hearing or seeing none. All those in favor?
Aye.
Aye. Opposed? Motion passes unanimously. Thank you. And so we have about 5 minutes if there are any things we want to touch on for the updates. Yes, Commissioner Sullivan.
Thank you, Mr. Chair. I'd just like to mention that both Andrea and also Julie Wilson, who was with us earlier, presented yesterday along with me at the Hub on winter preparedness. They did an excellent job. I really appreciate the opportunity to work with them. And they had about 20 people in attendance for that presentation. Also at the Hub, and Commissioner White, I'm sure you're aware of this as well, they've been serving meals, additional meals during the month of November to veterans. And I checked on the count, 68 veterans have been served meals to this date at the Hub. And lastly, just from the Emergency Preparedness Committee, I think you're all aware our hazard mitigation plan is online and available for the public to respond and react to. We're very interested in getting public comment on that. Thank you.
Thank you. Anyone else have a committee report or something they need to touch on? Sound like there's anything pressing. So then we'll just move on through to our last item, which is the adjournment. We are adjourned. Thank you.
Streamlining everything.
Sometime between December 2nd and 4th. Maybe we could head over there. We're just heading over there. Why?
Going to visit Mom?
What day? He means here.
Where she live?